Hi, I'm Beth Allen. I am very proud to be an ambassador for the New Zealand Gynaecological Cancer Foundation, an organisation devoted to helping women understand the symptoms of cancer of the reproductive organs. In New Zealand, one woman dies every day from a gynaecological cancer. The foundation is a cause that's very dear to my heart, as both of my grandmothers died from gynaecological cancer. As an ambassador, my aim is to inform as many women as possible about the symptoms of these cancers and to get you talking to each other and to your doctor. The best way to successfully treat any gynaecological cancer is to identify it early. As women, we tend to put our own health on the back burner as we focus on our career and our family, and the busy schedule of everyday life just takes over. By sharing the stories of several amazing women with you today, I hope you will stop for a moment and reflect on your own gynaecological health. To tell you more about the 4 main types of gynaecological cancers and their symptoms, here is one of New Zealand's leading gynaecological oncologists, Dr. Ailing Tan. Dr. Tan is a specialist who deals with gynaecological cancer patients every day.
Gynaecological cancer involves cancer of the women's reproductive parts, and what I mean by that, and I might just use some of the model I've got here to illustrate, I'm talking about cancer of the ovaries. There's 2 ovaries, one on each side. Cancer of the womb, which specifically I'm talking about the lining of the womb called the endometrium. Cancer of the neck of the womb, which is the cervix, we'll call that cervical cancer. And last but not least, the vulvar cancer, which is on the external genitalia of the woman.
For many women, gynaecological cancer is something that they're not comfortable talking about. Fiona and Carol are 2 remarkable women who've each had a gynaecological cancer. Fiona, cervical cancer, and Carol, ovarian cancer. By sharing their stories with you now, they aim to break down the communication barrier and help you to understand how important it is to listen to your own body and get to a doctor early. For US resident Carol Nelson, cancer was the last thing on her mind when she came home to Gisborne for Christmas.
Always been active, always enjoyed being outside. Being in Gisborne, I think you just learn to, do things like that. If I didn't go for runs every morning, I'd, think something was wrong with my day. Went in half marathons and just enjoy being out there actively doing things and not really one to sit around during the day. So, well, yeah, I always thought that would keep me healthy and strong and fit.
Another woman who thought she was too healthy to get ill is professional rower Fiona Patterson.
There's been a lot of highlights with my rowing career, but I'd say probably world champion, under 23 world champion in 2004 in the quad in Poland was probably a highlight, just standing on top of the world and with 4 of my good mates as well, which made it extra special. I didn't have a GP, I had a sports doctor, and so sort of only went to him when I had an injury or something that kept me out of the boat. As far as sort of small things go, I was quite prone to ignoring them and just letting things go. So that's how my cervical cancer went undetected for quite a while.
The diarrhea at the Christmas of 2005 was the first time that I noticed that things weren't too good. Although I was still active out there, running, playing tennis, but the diarrhea was persisting. Once my GP in the States had given me pills to try and clear it up, he referred me on to a gastroenterologist. The results of the colonoscopy were that my bowel was fine. But unfortunately, once he told me the bowel was fine, he told me that there appeared to be something pressing on the outside of my bowel, which needed further investigation. He then sent me off to a gynaecologist.
I was aware that something was wrong because I was bleeding irregularly, quite heavily towards the end before diagnosis. I was just so immersed in my training, and I thought that when you train hard you can lose your period, and I thought that, well, if you're training hard maybe you can just get it more often as well. So I ignored the symptoms for a while. I was also extremely fatigued, beyond what was normal for an athlete. I was exhausted, and I was really low on iron because I've been losing so much blood, and it wasn't until it got to a sort of dire point that I eventually took myself to a doctor.
The gynaecologist in America gave me a range of tests, one being vaginal ultrasound and the other being a CA125 blood test. The vaginal ultrasound revealed the tumour, and the CA125 blood results confirmed that they suspected it to be ovarian cancer. No time was wasted. I was then referred on to a gynaecologist-oncologist, and from there on things moved very fast.
During the examination, a piece of the tumour came off, and that got sent away to get tested. Came back, and it was I was diagnosed with clear cell cervical cancer, which is a rare aggressive type of cervical cancer. And that, yeah, it was a bit of a shock at the time, being 22 and diagnosed with a rare aggressive cervical cancer.
He had me in theatre for surgery within 10 days. April the 15th, that was our 33rd wedding anniversary, so I would certainly never forget the day that I had my debulking operation.
Well, the operation went really well. I had a node dissection and the cancer hadn't spread to any of my lymph nodes, which was really positive. But because it was such an aggressive type of cancer, I had to have radiation and chemotherapy. So that was a 6-week block. I always knew I wanted to have children, so having a hysterectomy was a pretty huge thing. There's options. I mean, I'm really open to adoption as well. I come from a family that's sort of half adopted, half biological, so I know it'll happen, I'll just have to do it a different way.
I was up about in the hospital really quickly. My surgeon told me I was fit and healthy, and he told me I would be up and about in no time. Spent my days going about the wards with my infusion pole, and usually went down to see the babies down in the maternity ward and look at them and hope that one day I would be doing the same at one of my grandchildren. And it was rather lovely to see the start of a new life with things that were happening to me, so it gave me the inspiration to get out of the hospital and get going, and there was things to do and things to see, and no time for sitting around being sick.
Cancer didn't make me feel like any less of a woman, like having a hysterectomy. It is a big part of who you are, but you can either sit around and dwell on it or just get on with it. I mean, to look at me, you probably wouldn't know that anything had happened, and yeah, that's kind of how I like it.
Dr. Ailing Tan will now sum up the most common signs and symptoms of gynecological cancer.
The symptoms of ovarian cancer are bloating, and what I mean by that is abdominal bloating, abdominal and pelvic pain, feeling full quite easily after you've eaten, and urinary symptoms, sometimes like frequency, going a lot, or feeling pressure in your bladder. Now, not all the symptoms mean you have cancer, but obviously if the symptoms persist and they're severe enough for more than 4 weeks, then you should consult your doctor. Endometrial cancer is the most common gynecological cancer, and the majority of women that have endometrial cancer are postmenopausal. Any woman who's gone through the menopause and has bleeding, that is abnormal. So that's pretty clear-cut. Now, it's in women who haven't gone through the menopause that it can be difficult, but if the periods are heavy but they're regular, that's probably not a problem. But if they're heavy and irregular, that is not normal. Your periods should get lighter and further apart. The next cancer that I'd like to talk about is cervical cancer, and as we all know, cervical cancer has a screening program, and that has worked very successfully in New Zealand in picking up precursors of cervical cancer. This has decreased the incidence of cervical cancer in New Zealand and also decreased the death rates in New Zealand. Now, if women have cervical cancer, the symptoms are that they can have abnormal bleeding, usually after intercourse, or an abnormal smelly discharge, or sometimes pelvic pain. Vulvar cancer involves 5% of all gynecological cancers, and 90% of vulvar cancers present with itchiness around the vulva and a lump. Unfortunately, most women do not come to see the doctor because obviously it's embarrassing to go and see a doctor with an itch in the vulva, and on the other hand, some of the doctors do not examine the patient. It's very easy to pick up any abnormality if the woman gets examined.
Dr. Tan says that a woman's partner can also play a vital role in detecting vulval cancer.
It's important that partners have a look, and if they think that there's anything that's abnormal, to persuade the partners to be examined, and mainly any abnormal changes in the skin or any lumps. That's usually quite a common sign of vulval cancer, but it can also be a sign of vulvar precursors, which are just lesions that are present, which are abnormal but not cancerous yet. So any abnormal lesions on the vulva needs to be investigated.
If cancer is diagnosed, treatment will be started as soon as possible.
There's a variety of treatments available. Usually they involve surgery, radiotherapy, chemotherapy, or a combination of all those three. Early detection obviously increases someone's survival rates. The important message for women is that if they have symptoms and the symptoms persist, then they should seek medical advice. If they're not satisfied with the medical advice, then get a second opinion.
And now to talk about some important issues for Māori and Pacific Island women is Hinurewa Te Hau.
E ngā mana, e ngā reo, e ngā iwi, e ngā tōpito e whā, tēnā rā koutou, tēnā rā koutou, tēnā rā koutou katoa. Ngā mihi nui ki a koutou, e mana wahine, ki a kaha. Nō reira, tēnā rā koutou, tēnā rā koutou, tēnā rā koutou katoa. Every year, as a percentage of population, there are more Māori and Pacific Island women diagnosed with gynecological cancer than Pākehā women. This has been addressed in part by the Ministry of Health Cervical Screening Program, but it is up to us to prevent other forms of gynecological cancer. As a mother, I know it's really important that we stick around for our children and our children's children. Get regular checkups, be aware of any changes to your body, don't be shy, go see a doctor. It could save your life. It saved mine.
Gynecological cancer can affect women of all ages and walks of life. The HPV vaccine, available free to all young women, can help prevent cervical cancer, and regular smear tests can help detect early changes in cervical cells, which, if left untreated, can lead to cancer. For ovarian cancer, the BEAT acronym is a great way to remember the common symptoms. B is for bloating that is persistent and doesn't come and go. E is for eating, if you have difficulty eating and feel full more quickly. A is for abdominal and pelvic pain that you feel most days. And T is for talking to your doctor. And remember, bleeding after sex or bleeding after menopause is not normal and needs to be checked out by a doctor. And remember also that in New Zealand, on average, 1 woman dies from a gynecological cancer every day. The 4 main forms of gynecological cancer are ovarian cancer, cervical cancer, endometrial cancer, and vulval or vaginal cancer. Ovarian cancer is the 4th biggest killer of New Zealand women, with 1 woman dying every 48 hours from ovarian cancer. As a percentage of population size, there are more Māori and Pacific Island women diagnosed with gynecological cancer each year than Pākehā women. If you would like more information about the Foundation, go to our website www.nzgcf.org.nz. To talk to a cancer nurse, you can contact the Cancer Information Helpline, free phone 0800 CANCER. The New Zealand Gynaecological Cancer Foundation is a non-profit organisation. You can donate to the Foundation via our website. Your valuable support is vital for us to continue to educate New Zealand women and to significantly reduce the incidence of gynecological cancer. Thank you.